Hi, today's video regards training surrounding discharge planning. Um, Honestly, discharge planning, in my opinion, for everyone should start from the day that you know or decide that the person is being discharged. But this training is specifically obviously regarding those with disabilities. Um, So for this, I just want to say, like, let the person know at least 2 days in advance. If it's if the weekend is the 2 days before discharge, at least 3 days in advance um, of discharge, that their discharge date is coming up and what time on that day it's coming up. And ask them if they feel like they're ready for discharge or not. And just talk through with them what's going on and why they might not feel like they're ready for discharge. And literally don't say, look at just what they did in the unit when trying to plan like the step down process. Because at my most recent hospitalization, somebody from the outpatient side came and talked to me before I was discharged and said, based on what you did on the unit, we think that IOP, which is intensive outpatient, is best for you because you got out of groups. Well, I was on the unit for, number one, for a reason. Number two, I wasn't given accommodations. Number three, I didn't even realize I was leaving the groups. So why would you just not, why wouldn't you talk to the patient about why they were living in groups? Because then you might realize that they didn't even know that they were leaving the groups. Let's see what they think is the best plan for them. And like start the planning process days ahead of time, just so they have more time to process what's going on and process that it might be getting out and when they might be getting out. Yeah, I get it. There's things that might complicate that because something might go, like, they might start having side effects of a medication, so then they have to change meds and might be held another day. Like, I was on the medical part of the hospital in September 2021, but at least explain that to them. Because there are people just like everybody else. They want to know what's going on. They want to be able to understand what's going on and be able to be told and feel like a normal person, even though they might have a disability or on top of a mental health condition. And that's the thing. You have to get somebody that might be trained in a medical condition to be on the unit when they're on the unit or coming to the unit from time to time when they're on the unit to stabilize them on that side of things instead of transferring them down to the medical and interrupting their process health stay, mental health unit stay, which is the reason they were admitted in the first place. Another thing is, I know, at least in Maryland, before we're discharged, either the day before or the day of, we um, get this form to fill out called a safety plan for when we're outside of the unit, back like in our normal everyday lives. And some of those questions are like, what would you do if you feel this way? Like, what can you do to feel better? Um, and my problem was with my first two hospitalizations, at least, I didn't even have the option to talk with someone. Like, they didn't even give me that option to talk it over and get examples and get like explanations as to what the questions meant. But my third hospitalization, I did. The person literally said to me, "Do you want to do it yourself? Do you want help?" And I appreciated that. But um, and then I would go more into post discharge tomorrow, but it's part of the discharge planning also, since you create the safety plan for when you're discharged, when you're still in the unit. Um, give them, make sure you give them multiple copies of the safety plan, because they might not remember where they put it, or their other providers might want a copy of it, and they give it to one of the other providers that they see outside of the unit, and they don't get a copy back, and then they don't remember who they gave it to. So please ask if they want multiple copies of it when they're discharged. That way it helps you plan where their discharge day better. Um, and on their discharge day, as part of the discharge planning, maybe talk to them like, you getting discharged today? Do you feel ready? Do you feel like you need to stay a little bit longer? Do you have any questions? Do you need any clarification? Like, instead of just giving them a bunch of discharge paperwork on that day, actually explain everything to them and explain why they might be seeing different levels of their medications that they might have not been aware of when they were actually being treated. Um, because that would have been helpful coming home this time when I thought I was at some level of one of my meds. Well, on two of my meds, but they lowered one and then upped the other one. Um, I think they did it that way because I was concerned about the effects of the medication for those that the side effects of the lithium for people with a history of seizures. They wanted to up it more than they did. So I appreciated that the psychiatrist on the weekend listened to that and said, okay, let's do it this instead of, let's do this level instead of this level. But I didn't realize that it was, my Cymbalta was being lowered at the same time. They never talked to me about that. Um, so just explain to them why, because I realize now that maybe that's because both of them combined, both the Cymbalta and lithium combined, can cause this thing called serotonin syndrome. And there's a lot of symptoms of that. was experiencing that I didn't realize until I did my own research about what it was. So basically, like the handshaking, the bathroom problems that I was having. There was a bunch of stuff. I don't even remember everything that I was experiencing. Um, Irritation, but that could have been my Kebra at the same time. Um, so yeah, it's just explain what the possible side effects could be to them. Both they have medications and if they're combined, like why they're combined and the possible side effects of them being combined. So they know what actually to look out for when they are at home and with the outpatient providers after they're done with the step down programs, if they're doing any step downs. Um, that's it for tonight, and I will see you again tomorrow. Thanks. Bye.